The following audio-supported podcast is intended for informational and educational purposes only and is not intended as medical advice. Please speak to a healthcare professional before making any treatment decisions. The guests on today's show were paid to participate in this podcast.
Hey, Thal Pals. It's your fellow patient advocate, Nina Maria, and you're listening to Thal Pals, the Alpha Beta Revolution. Today's episode is all about transitioning from pediatric to adult care. And I have a super special guest to me that's very important to me, Melanie Howell, who's a nurse practitioner at the facility where I get treated. She is one of my providers, and I'm so excited to have you here to, share some of the amazing things that you work with me, with everyone else. We talk about how this is, a scary time, going from one space to another, a comfortable space to an unfamiliar space. Is there any kind of support in the community or any kind of support systems for patients in this realm?
It's a great question. So when I started at Children's and working in the clinic, a lot of the patients that I would see would really express to me that they didn't know anyone else with their disease type. So whether it be thalassemia or sickle cell, primarily what we see. So as we started the transition program at Children's, I also started a community support group for young adults because, again, this being such a unique and vulnerable time when you transition, but just going into adulthood, I wanted to try to build a sense of community. And we have a lot of adult support groups and we have a lot of pediatric support groups for the parents, but there was nothing for patients in this age range. So we started meeting. We meet once a month. We've met about 5 times. We've done some events like a baseball game, and we just did a karaoke game night, which was so much fun. And the patients, this was specific to sickle cell, is called 313 Warriors because it's in Detroit, Michigan, and they named it. And it's just been so great to see. Some of those patients were inpatient recently, and those in the community support group were coming to the hospital to visit them while they were inpatient. They were able to collaborate as inpatient. They're advocating for each other to see this come alive and to see what we're trying to teach them and instill them in transition is coming to fruition because they've met as this community. So something I want to talk with you further about in the thalassemia space of opening this up to young adults, because again, it's a unique time and you don't quite fit in that adult setting and you don't fit in the pediatric setting with the parents anymore. So something really truly dedicated for you guys dealing with chronic illness and this time of transition.
I think that's so special because, having rare disease can be very isolating.
Yes.
In general, a lot of times patients don't know other patients. They don't have anyone that they can share with and just feel like someone who relates to them on that level. And even, you're diving even further into that on a specific level of this in-between stage, which is already kind of hard in life.
Absolutely.
So I think it's so important, and, we need more of those community gatherings to just lift each other up. It makes all the difference.
Perfect. Well, I'm going to lean on you to start that with me.
Okay,
That's our next mission.
Let's do it.
Okay.
Agios is a biopharmaceutical company that's fueled by connections with patient communities, healthcare professionals, partners, and each other. Building on these connections and the company's unmatched leadership in PK activation, Agios is pioneering therapies for rare blood disorders, including PK deficiency, thalassemia, and sickle cell disease. To learn more about thalassemia, visit rethinkthalassemia.com. To join the conversation with other patient allies, follow us on Instagram at Ally Voices Rising. That's Ally, A-L-L-Y, Voices Rising.
I want to start with your background in hematology and what it's been like, because you didn't start in hematology and rare disease. What was it like going into that? Why did you do it? What has that community been like?
Okay. Thanks, Nina. So my background started, I just wanted to really be involved in primarily pediatrics when I first started out, but to be with patients that were dealing with probably one of the most severe conditions of their life. And that for me was oncology at the time. And I wanted to serve in a community that was going through a difficult time. And wanted to really be there for them and advocate for them and learn how to be the best provider that I could. So I started out in oncology for many years, and then I moved to the state of Michigan for my husband's job, and fell into this new role at the Children's Hospital because I met my colleague and now my friend, Dr. Alex Glaros, who's the director of the sickle cell clinic, the hematology clinic there at Children's. And because our kids play together, we met in the park, and he started describing what he did at Children's. And in the hematology clinic, he was establishing and really needed a provider to help pediatric patients transition to adult care. And there's such a gap and such a need for this in our healthcare system nationwide. And I basically told him there that this would be my dream job, that my focus has always been in adolescent, young adults. They're my favorite to take care of, but also chronic illness. And I didn't have a whole lot of experience at the time in hematology. About 17 years back was when I took care of some hematological conditions on the floor as a nurse. And then when he hired me, that's really when I started learning and diving really deep for the past 2 years. So.
And how does it feel now, 17 years after working, one-on-one with these kind of patients? How have they touched you?
So, every patient is unique, obviously. Um, I think what keeps me passionate about it is I like to ask the hard questions. I like to get in your business. And for me, it's about being real and just connecting with the human, not just about what you're dealing with in terms of your illness, whether it's thalassemia or sickle cell, or um, but what also are you dealing with in life, and really need to connect on, because life is hard. And at this age, this young adult, as we're going to talk about, from pediatric to adult care, it's such a vulnerable time in life. And I've learned that even more being in the clinic the last 2 years. There's unique things that come up, and whether it's job or college or finances, and moving on to be an adult, and you're moving out of your parents' home. There's just such unique things that come up. And I'm just driven by trying to get to the core of what's happening, both from a disease management, symptom management, but also just life, what's going on, and where can I help you and be of service. And that's truly what I want to do and what I'm passionate about.
And you do well, because that's what I love. One of the things I love about you is you ask those questions. You go beyond, the science and the medical and the tests and the medicines. Like, yeah, we do that. But you go past that, because there's so much to life with thalassemia.
Yep.
It really touches every aspect of your life. And I think sometimes we forget that. I think, doctors sometimes accidentally forget that. But, asking those questions, the life questions, and work, and, sleep schedules and fitness and things like that.
Yeah.
You dive deep into
Nutrition.
those. Yeah.
Yeah.
And it really does make such a difference in the day-to-day when you can really zero in on those things. So let's talk about transition.
Okay.
Why is it important to go from pediatric to adult care?
Yeah. So it's been a hot topic for a few years now. GOT transition was first started, I believe, in 2014, but they were revised it a few times in 2023, I believe. But it became sort of this mission to better educate from both healthcare providers, but also patients from pediatric. How do we get them to adult care? And specifically with chronic illness, as you well know, pediatric hospital entities take care of you through your lifespan. And it's challenging because it's hard to find providers. And I know you've talked about that on the adult side that know and are experienced in thalassemia. Same, and I talk about the sickle cell clinic too, because it's all combined in our hematology clinic. But this vulnerable time between 18 to 27, I kind of stretch it a little bit and think that it's like 30 is really the sweet spot of very unique things going on. And it's important because when you're cared for by a pediatric setting, primarily, you have so much support around you. You have your parents or your family network, a core group of people around you. Even if it's not mom and dad, you have to have some support system, right? And then there's an overabundance of people in pediatrics that want to do right down to the details, social workers, physicians, nurse practitioners, nurses. There's just a good core team, right? And then when you get to adult care, and I have a lot of experience in adult care, which was why this was fitting for me. It's not that you don't have great providers, because there are great adult providers, but it's on the onus of the patient to really advocate for themselves, to um, be able to tell their adult provider what they need. And in the pediatric setting, it's kind of known, and you have your parents there, and people are paying a little bit more attention because you're a child or a young adult or an adolescent, a teen. So how do we really prepare pediatrics to go to the adult healthcare system is transition.
Mm. And what does that look like? What is the patient going through in those stages?
So when I first started, I sort of looked at the concept of transition, so pediatric to adult care, and what really needed to be taught. How do we educate? How do we prepare patients to go? So what that looks like for us in our clinic is we start at about age 12. So we have identified about age 12, and then we've loosely given, let's say, 22, but it's a shared decision at what time they will transition to adult care. And there's no set age limit right now for that. And the maturity and of the patient comes into play and all those things, but shared decision when they're going to transition. But how we start is we identify those patients, they meet with me, and we give them a policy letter, an intent of like what we're intending to prepare them for over the course from 12 to whenever they transition. So that policy letter was well drafted by Dr. Galeros, actually, and beautifully written, to really just tell our heart of what we wanted to see happen. In our clinic, we called it the Growth Clinic. So it's called Gaining Responsibility, Owning Wellness, Transitioning Healthcare. So they meet with me every 6 months, and it's a defined curriculum that I created so that we can go through education topics. They can meet with social work. They can meet with all of, hopefully, more and more entities as we grow to help support them. But it's a defined curriculum so they can be educated and well prepared to transition.
Yeah. So ideally, this is kind of a learning process over time.
Yes,
It's not like an abrupt, okay, you're 20,
right.
go see a different doctor.
Exactly.
So patients are kind of ideally learning slowly.
Yes.
What kind of things are they
That's
learning?
exactly. Yeah. So when we start at age 12, I call it like an introduction. So for thalassemia, it would be an introduction to thalassemia. So whether it's talking about the disease process, how it's an inherited condition. I mean, you'd be surprised how many 12-year-olds, they don't actually know this information when I ask them. They don't know what type of thalassemia they have. They don't know what type of sickle cell they have.
Also thinking, a lot of these patients were diagnosed at a very young age.
Absolutely.
Their parents have all this
Yep.
information, but sometimes it doesn't get translated.
It doesn't.
to us as we
Right.
can comprehend it.
Yeah. And one of the things that I've also honed in on just with my experience there is that, and this is not disparaging or meant to be disparaging, but as pediatric providers, a lot of the time the focus is on the parent, right? I'm speaking to the parent when I sit in the room. And I go in, and my mission and what I do is I sit and I talk directly to the patient. And the parent, of course, is there. But my focus is I'm talking to you, and I want you to answer the questions, and I want you to tell me. And sometimes it's hard because they're not comfortable with this. I always ask at the end of the visits for them to either ask me now or come up with a question that they want to ask me before they return. So I don't want it to be, it can be about anything. What's my favorite color? But how they get established rapport so they feel comfortable talking to their provider.
Mm.
Yep.
What else did it work?
Oh, sorry. So So we talk about, introduction and what type of thalassemia or what type of sickle cell they might have. So we start at the basics, basically, and I've created these learning modules for them. Um, and I have some kind of education tools that go with it. I call them education binders, and they're a visual aid that they relate to the topics. So basics of the disease. For thalassemia, it might be, their transfusion schedule, what that looks like. So let's talk about why you're receiving a blood transfusion, what medications you need to be taking. So we talk about medications, medication adherence. Um, and then we also, for sickle cell, it's related to like pain crisis. So the topics are related specifically to the disease, right? And then we talk about, I want them to know, insurance information, because when they turn 18, that might change, right? It does change. I want them to know their rights when they're 18, because I no longer can really interact with the parent. I have to get permission from them. And do they want that to be that information shared still with the parent? If the parent calls, I have to tell the parent the patient has to call at 18, right? So all of these nuances of now being an adult, this is what we're talking about in the curriculum, but also just making sure, we go through, are there IEPs at school? What are they struggling with in school? We focus on all of those things in the visits.
There's a lot of layers to
A
it.
lot of layers, yeah.
That's so intensive, and I think it needs to be.
It is, and that's why we meet every 6 months, and then, how I've written the visits over their, time with me is when they come back every 6 months, we'll do a review of the topics we talked about at the first session. Um, there's reproductive health built in. You're putting me on the spot with the topic, so I'm going through what my curriculum was built on. But as you get older, no one addresses a lot about reproductive health, right? And I know you and I have talked about that briefly in our visits, but I'm passionate about that. I want there to be resources out for women and men that need them, but counseling them. But also we go back to, this inherited disorders, and you need to be prepared if you have a child and what that looks like for you. So we talk about genetics in the curriculum as well, and then as it relates to reproductive health.
You mentioned that pediatric to adult care is a little more hands off. It's more on the patient to kind of take more control. But does the care itself look different? Does the team look different? Or is it similar?
Okay, great question. Um, so I feel like in both settings, you can get excellent care. And both in the pediatric and adult setting, there's providers that are so dedicated to the mission, and they're passionate about the work that they do. So I think probably the biggest change is that maybe your own personal support network might look different, and you're no longer going with your parent to your visits, although in adult care you can bring someone as well, but often that visit is conducted alone. And but there is good support staff, social workers, nurses, nurse practitioners, physicians that are going to be there on the adult side to take over and care for you. My goal and my mission, though, is to make sure that you can advocate for yourself, because in either setting, really my mission is that it's about the individual. It's about the individual patient, that they can go across any healthcare system and be successful, and connect with their providers and connect with the people that they need to get what they need.
Awesome. And you've detailed this curriculum that you use, which I think is incredible and important, and we need more of. But I think there are probably a lot of facilities out there that don't have this shared emphasis on transition. Um, how can a patient kind of make that transition smoother if there isn't this sort of curriculum? What can they do to have a successful transition?
Yeah, it's a great question. Yeah. I think it's a hard question because, you know, you have to have that on your providers in the initial setting to really know, be teaching you all the information. But I guess as the patient, it's just asking questions and being comfortable, asking for what you need. Um, and if you don't know information, is, looking it up and coming with maybe a checklist of questions that to your provider about what you might need to learn if you don't already know, whether it's medications that you're on, names, dosage, just really honing in on what information you might need. Um, and being able to, again, feel comfortable asking those questions of your providers, I think. And I think talking about it and transition, like I said, has been a big topic. But how do we as providers, how are we going to get more educated? And there are other facilities all around the nation that have um, curriculums as well, and programs and teaching tools. But we can definitely do better. And that's what Dr. Glaris and I kind of set out, is that there's a lot of information out there, and there's a lot of tools out there, because there are with God Transition and templates to be used. But we do need to do a better job, and we need to make sure that our pediatric patients are just well educated and can advocate for themselves, and that's really our mission when they go to the adult healthcare system.
I think that emphasis on ask the questions
Yeah.
is huge in any setting. I think, you know, it might be sometimes intimidating, but like, do not be afraid to ask your doctor,
Yeah.
physician questions.
Absolutely.
Like, that information is like the most powerful tool. And you tell me, what are there, questions can go beyond just, medicine, or,
Absolutely.
questions. You can ask any question to your doctor, which I do to you. And
Yeah.
that's what makes it so helpful, is like, don't be afraid to ask anything, I guess, is my point.
I mean, we spend a lot of time together, right?
Yeah.
And I don't get to see you as much as I would like, because we trade off. But you're seeing your provider so often, and really, I was realizing this even coming to meet you, Nina. Like, I never want it to be like a drive by, and we all get busy, right? But we need to sit down and take the time, because yeah, I can ask you how you're doing, and you give me the answer like, I'm great and nothing's changed, and then we can kind of move on and go on with our busy day. But how we truly connect is like sitting down and taking that time when we have it, and we're all busy, and we know that in healthcare. But like we were talking about, asking the hard questions, making sure that you're comfortable to ask me things that are outside of just maybe why you're there that day for your transfusion, because it's all important, and it affects your health. That's the main thing is, if you have a life stressor like your sleep schedule, for instance, or, we have a lot of patients that financially are struggling, and they have jobs and they're in and out of work and things like that. Um, that takes such a toll on your overall health, and it's all connected. And if we don't ask those questions in the visit and really get to the reasons why someone might be struggling outside of just their disease, we need to hone in on that and really be able to provide resources when we can.
Absolutely. And when it comes to those outside stressors, transition care can be scary.
Yeah.
What, what about the mental and emotional aspects of that? What can that feel like, and what can patients do to kind of get through that a little smoother?
Yeah, it's a great question. And I don't mean to put you on the spot, but even our conversation over there, like, your whole demeanor changes because you don't want to leave pediatric setting, right? So let's talk about that, because, like I was mentioning, I've only been in the clinic 2 years. And just as I said to you, I'll say to my other patients, like, when they meet me, I'm a new face too, right? And they haven't seen me for 17 years or however old they are in the pediatric setting. Um, and you know, I want to I know that this is my role there, right? So, that's how I walk in the room, is like, I know I need to connect because you haven't met me before. I have some experience moving around the country because of my husband's job. So I've learned this skill where, like, I'm always the new person, and I always kind of have to, like, put a little extra, because I got to gain your trust, right? But I think if we as providers can let our guard down a little bit, especially in the adult setting when you're meeting new patients, is to kind of just make people feel comfortable, and allow them, the space to be nervous, because you've been going to this facility as, for how many years? 27 years? Nina?
28.
28
Yeah.
years. So then
But
to say to
it's a
you,
comfort. It's like a home,
yes, absolutely. And all your providers, right? But for me to tell you, hey, we're gonna maybe transfer you over to the adult setting and it's going to be time here soon. Absolutely, that's going to cause some anxiety, some uncertainty. And are you going to trust your providers? Are they going to be good? Is your health going to be managed well, right?
Yeah.
And I guess my um is to acknowledge that yes, it's going to be scary at first for sure. And some of the things that we've tried to do to mitigate that in our clinic is, it's not going to just be a quick handoff. So they're meeting with me over time, as we mentioned. But if we don't have time, like say I'm meeting an 18-year-old, again, it's that shared decision about when you're ready. So you're going to keep coming back to see me until you're comfortable. And then what I've done is we've established that on the adult side, I would go over and accompany them and I introduce them to the staff over there and I show them around the facility. And we've done that a couple times for patients so far. And it's worked well that they have a familiar face on the pediatric side. And, I accompany them over to the adult side. So those are some things which, depending on transition clinics, they might be in the same setting. So like ours is separate because we're not attached to an adult center. But places like Johns Hopkins and other big facilities, they're kind of, they go from pediatric and maybe like the next building over is adult. So the facility might not change, but the provider will. Um, in our clinic, they're not doing that. We're going across the different healthcare system, which is okay. But again, trying to establish in these transition programs, can we provide that kind of service where we go over and really help to diminish some of the things that we can control that might help with that mental burden of transitioning care.
And do you have any advice for physicians who might not have a super special transition person like you to kind of mitigate and make that the smoothest as possible for their patients? Maybe they're a little shorter staffed,
Right.
or they don't have that person. Do you have advice to them to kind of help their patient?
Yeah, I would think that in the pediatric setting, maybe it's just a phone call to the adult setting. You might not be able to go over and meet them in person and take the patient over because that does take a lot of time. But absolutely, again, part of what we do is we create sort of these patient summaries of your health history. So we would review that together, and that would go with the patient over that they can hand off to the adult provider. And in the same fashion, if the pediatric provider can call over to the adult side and make that connection and help them get established in the adult setting, they can do a patient care summary as well and send it over and make the introduction at least by phone so that the patient and the provider know that there's some communication, some interaction on the adult side. I think would be really valuable because if you just give them a referral and send them on their way, there's a huge disconnect, right? And people, if they're not comfortable, they get lost to follow up. They may not go back to that adult setting, and there's never an exchange of communication there for the pediatric patient or the pediatric setting to know. And so just reaching out and making that general introduction and follow up would be really important.
I think that's where a lot of that anxiety comes in is, you know, will I not be taken care of as well? Is there going to be, you know, missing pieces lost in translation? And, we know our doctors, our providers, you're busy people, you're taking
Yeah.
care of a lot of people. Um, and, it's, it's that fear of, that the care that I'm getting now is not going to be the care that I'll get. So I think those little steps make all of the difference
Yeah,
for the patient.
absolutely.
Is there anything a patient can do just in preparation or anything that they should do as they go into this transition period?
On the patient side, let's see. So, again, I think we talked about the checklist would be important, but yeah, writing down too, what are your fears? What are you most worried about? Um, what can we talk about that helps you feel like you can advocate for yourself with a new provider, a new face? And if there's problems and there's things that aren't going right, then what do we do, right? Let's put a plan in place. Are you going to contact, your pediatric provider and kind of try to figure out a solution, or do you find another adult provider, right? So It's a tough question because it may be so specific to like how they feel about it or what they're dealing with. But I think just having that conversation with your pediatric provider, opening that dialogue up, just trying to find out,
dig into those feelings,
yeah,
those fears, like, and address them. Don't be, I guess, like, don't feel as though you have to go through them alone.
right,
I love that.
yeah.
And just one piece of advice, as that patient, is going into their adult care, what's one thing you can say to them just to give them a little encouragement, motivation?
Mm. One pearl of wisdom here, Nina. I think the most important thing that comes to mind is that each patient really matters and it's about the individual. And I want them to know that everything they're going through is unique and it's not the same. And to really carry that over to the adult provider to say, like, you may have seen a thalassemia patient, you may have seen a sickle cell patient, but as an individual, like, what are your needs that you really need to be met? And say that up front, I put a little special summary or a little special paragraph when I send the patient summaries over to the adult side. That's kind of one little caveat about that patient or a special thing about that patient so they can kind of get to know. And I would really love the pediatric patient to be able to carry that over. And that I hear this a lot in our clinic. That they don't always want to get together and just talk about what they're going through in terms of disease management. So come up with something else to like help identify your need and who you are as an individual to really convey that to your adult provider in addition to what you need medically.
Yeah, and just knowing you're important.
Yep.
You matter and your feelings matter and your concerns matter.
Absolutely.
Love it.
Yep.
Melanie, thank you so much. This has been such an enlightening conversation, and
My honor.
I mean, actually, when you were on.
My honor to be here with you. Absolutely.
And thank you for our listeners listening to this episode. Don't forget to subscribe, share, and join us next time.